Have you ever found yourself trying to explain a new health concern to your doctor, only to realize you are not quite sure when it all began? Knowing the exact timing of a symptom can be as crucial as describing the symptom itself. Getting this detail right can make all the difference in understanding what is happening with your health. The best way to tell your doctor when a symptom started is to link it to a specific memory or a clear, simple time frame. Even an approximation can be incredibly helpful. This approach helps your doctor paint a precise picture of your health journey, leading to more targeted and effective care. Knowing the exact or approximate start date helps your doctor understand the symptom's duration and progression. This information is vital for narrowing down potential causes and guiding diagnostic steps. It allows them to differentiate between an acute, sudden issue and a chronic, gradual one, which can significantly change their approach to your care. First, try to connect the symptom's onset to a significant or memorable event. For example, you might say, "It started the day after my niece's birthday party," or "I first noticed it during my vacation last summer." Even linking it to a major holiday can provide a useful anchor for your doctor. If an exact date is impossible to recall, use relative terms with more detail than simply "a while ago." Instead, try phrases like "about 2 months before my last checkup," or "shortly after I changed my diet." This gives your doctor a much clearer sense of the timeline. It is also helpful to clarify if you are talking about when you first noticed a subtle change versus when it worsened or became disruptive. You could say, "I had a slight cough for about 3 weeks, but it became much worse and constant starting last Monday." This distinction provides valuable context for symptom progression. Another excellent strategy is to keep a symptom journal. A simple notebook or an app on your phone can be incredibly helpful. Note down the date, time, what you were doing, and how the symptom felt. This builds a reliable and accurate record over time that you can easily share with your care team. Doctors often refer to this as establishing the onset of a symptom, a critical piece of the history of present illness. A well-described onset helps differentiate between conditions like a sudden infection versus a slow-growing condition. For instance, explaining that shortness of breath started gradually over 3 months versus suddenly last week points to very different diagnostic pathways. This detail helps them leverage their clinical expertise more effectively, leading to a faster and more accurate understanding of your health. By taking a moment to recall when your symptom began, perhaps by connecting it to a personal event or by keeping a simple record, you empower your doctor with precise information. This clarity helps them make more informed decisions, guiding you toward the right tests and treatments, and ultimately helping you feel better faster.